are live. So welcome everyone. Thank you so much for joining us today for this program. I'm Kay from the Chamber, and I am always very happy to be here. I am here welcoming Stephanie Johnson from USI Insurance Services, who is very generously supporting us with programs such as these. So with that, I'm going to pass it over to Stephanie. Thanks so much.
Thank you, Kay. Thank you for joining us this afternoon for our compliance webinar. USI is a proud member of the Morris County Chamber, and we're so excited to partner together for this event today. I wanted to begin by giving you an introduction to USI before I pass the torch over to our host today and compliance attorney Yesenia Perez. USI is a $2 billion brokerage consulting firm with over 200 offices across the US with over 8,000 employees. We also have 4 divisions of our insurance. Not only do we have the employee benefits, but we also have property and casualty, 401k, and personal lines of insurance. Our office is actually located in Florham Park, where the Morris County Chamber headquarters is as well. So we're right behind the Jets on Park Avenue. So just giving you a little bit of a background about who we are and what we do. After this call, I will go ahead and share my information. So if anybody has any questions about USI or about the material that is discussed, you can go ahead and send me an email and we can discuss that in further detail and I can get back to you. That being said, I want to introduce you to our Northeast compliance attorney, Yesenia Perez. Yesenia, take it away.
Awesome. Thanks so much, Stephanie. So we have a lot of information to get through today, and I just want to get a couple of housekeeping items. We do have a SHRM credit available for those of you that are watching live, and that will be shared at the end of the presentation. If we don't have enough time to answer your questions, please reach out to Stephanie. Her email will be shared at the end if your question is unable to be answered. We have a lot of information to go through, and I'm going to get started with the agenda. You'll see that I crossed out the second bullet, and the reason for that is this presentation would have been 75 slides if we did that. So I crossed it out because the COBRA subsidy is already ending in a few days, and so are the tax credits. That said, if you don't know what I'm talking about when it relates to COBRA subsidies and what that looks like, please reach out to Stephanie. We have other resources we can provide you, even if you're not a client of ours, compliance updates, things like that. So today we'll talk about COVID-19. I wish we could get away from it, but unfortunately it's September 2021 and we're still talking about it. So we'll talk about the impact on group health plans. We'll talk about COVID relief, vaccines and incentives, everyone's favorite topic right now. We'll jump to surprise medical bills, and then we'll talk a little bit about transparency. That's something that if I had presented 6 weeks ago, this would have been an entirely different presentation. Some of the provisions have been delayed, so we'll talk about that. Then we'll touch a little bit on miscellaneous items that impact your plans next year. And then finally, we'll touch very briefly on New Jersey perspectives. This year, New Jersey's been pretty quiet, so we'll talk about why that is at the end. All right, we'll just jump right in. COVID relief. So there are 2 periods that all HR professionals should be aware of right now as it relates to the pandemic. The first is the national public health emergency. That relates specifically to your plans themselves. This is the Department of Health and Human Services, their secretary would indicate that there is a public health emergency. This is different from the outbreak period, and we'll talk about that on the next slide. The emergency period can be pushed off by the Secretary of Health and Human Services. And what it does is it requires certain group health plans to pay for certain things during this period. It's been pushed off, every quarter, essentially, it's 90 days, it gets pushed off. The last time it was pushed off until October 18th. We do expect that the public health emergency will likely go through the end of the year. But again, they only have the authority to do so on a 90-day basis. And that emergency period relates to testing, to vaccines, some other relief as well. And again, we do have a compliance update on that. You'll see screenshots throughout this presentation. Those documents are available for prospective clients. So if you're not a client of USI's yet and you'd like to see what our updates look like, just go ahead and let Stephanie know what the title is of the document you're looking for. We can easily pull that for you. The outbreak period, so this is that second period. So the first one relates to your group health plans from a medical perspective. The outbreak period, on the other hand, is actually not the Department of Health and Human Services. This is the Department of Labor and the Department of Treasury. So they have dictated another period, which is going to give your employees and participants of your ERISA group health plans additional time. So what this outbreak period states is that it started on March 1st, 2020, which feels like eons ago. But March 1st, 2020 is when the department said, outbreak period is starting now. And it's not going to end until we say it's over. And it's not over yet. And so the reason this is impactful is that the guidance that was provided originally back in March and April 2020 was that individuals were probably going to have at least a year of a period in terms of being able to notify the plan. But we're still in the outbreak period. And so what happened in February of this year, the Departments of Labor and Treasury came out and said, individuals that have experienced some type of event, qualifying event, COBRA event, during the outbreak period, March 1, 2020 until now, that person's actually going to have the earlier of 1 year in which they should have notified the plan to do whatever it is they're looking to do, or the end of the outbreak period, whichever one is sooner. Confusing. But what this really relates to now in September 2021, I want to direct your attention to the HIPAA special enrollments. I think that is probably the most typical questions that we get from our clients and what we're seeing today, final quarter of 2021 in terms of still being impactful. So this is a chart of all of the relief that is available under this outbreak period deadline guidance. And this is huge because what the guidance has said is basically, if I get married, let's say I got married 6 months ago, normally I would have had to notify HR within 30 days to jump on the plan, right? During the outbreak period, you actually have, again, the earlier of 1 year from when I should have notified you 6 months ago, or the end of the outbreak period, which has not ended. So that means I can actually come to HR and say, hey, my husband and I need to come on the plan. I know we got married 6 months ago, but I want to use my outbreak period, special enrollment deadline extension. And so they would be able to do that. Coverage is going to be prospective for the major medical plan for almost all of those HIPAA special enrollments, except for date of birth of a child. So if there's a child involved, that's retro to the date of the event. So 6 months ago, I had a baby. Now I have to enroll myself, my family, my child 6 months ago. And I can do that. As an employer, you'll want to work with that employee to figure out owed premiums. The chances of this happening are pretty slim, but I have seen a couple of employees in the last couple of months that forgot to notify HR. Normally, they would have been out of luck in order to come on the plan. But that's not the case right now. As I stated, again, we have more time. Some of the other items listed on this slide do affect or are affected by the outbreak period. But in the interest of time, I'm just going to leave the information here for you to review. We are sending a copy of the slides as a PDF, so don't feel like you need to furiously write everything down. Just listen and think about how this could impact your plans. So there are some items throughout this presentation where I'll just quickly blow through it. It's because it's more of a piece that you can think about later on. So again, just kind of try to highlight the areas that our HR partners are really thinking about today. All right, COVID testing. This one's kind of an easy one. Right now, again, we are in that public health emergency. So your plans, your group health plans must cover COVID-19 testing in almost all cases, except for the two that are on the right-hand side. So on the right-hand side, COVID-related treatment. So if someone actually gets COVID and has to go into the hospital, that person's claims don't necessarily have to be covered at no cost. That some of the carriers were being generous and allowing 100% no cost sharing. We're starting to see that roll back. So keep an eye on that. If you have a fully insured plan or if your plan was super generous, keep an eye on whether your employees now are going to be subject to deductibles, co-pays, co-insurance, whatever it is for that hospital benefit. But as it relates to testing, if you are requiring employees to come onto the site and the only way they can come onto your site is by having a COVID test that says negative, that is not required to be covered by your group health plan and will likely be denied. So if someone goes to get a test and says, I'm doing this because my employer requires me to, you're probably subject to paying for that test. And we'll talk a little bit about that in a few slides when we get to employer return to work strategies that we're seeing in our market. Okay. All right, COVID-19 and the group health plan. So this is really USI's wheelhouse in terms of employee benefits. We really try to focus on ways to strategize how to lower the cost of the group health plan, impact your population, increase utilization of the PCP engagement. So we really do try to utilize that group health plan to better serve the needs of your population. So at the end of the day, your plan has to cover COVID-19 vaccines if it's non-grandfathered. Right now, we know the government is subsidizing the cost of the vaccine, but not the administration. So right now, your plans are being hit for the vaccination administration costs potentially. We don't know if that subsidy is going to go away next year. If it does that mean that now plans will still have to cover that? If so, is there going to be any type of government funding? We're not sure. So that's just something to think about as you come into 2022, that we might see an increase in costs. We might see some type of tax credit. So more to come on that. But I think it's something to think about. Right now, your plans are required to cover. Government's thinking about assisting at least right now. Are they going to do that tomorrow? We're not sure. Okay, mandatory and voluntary incentive programs as it relates to COVID-19. This is an area where I've gotten hundreds of questions since the start of this year and the vaccines were more prevalent. So we've tried to digest, we did an entire presentation just on vaccines the other day internally. So I've digested a lot of it into a smaller portion. But again, if there's anything that I'm saying that you're just not really too sure about, take a look at the slides again. There might be more information on there that I didn't touch because again, interest of time, trying to give you as much as I can high level to give you something to think about as you go into renewal season for the 1/1 plan year. Okay, everyone's favorite question. Can employers mandate or incentivize COVID-19 vaccination? I would hope that most of you know the answer now is yes, but there's always a big but, and the but comes with 10 more slides. So the EEOC, the Equal Employment Opportunity Commission, they're the agency that comes out and provides guidance for employers whenever we have a situation like this or wellness programs, things like that. So they came out in May of this year and provided guidance, a little late to the game, but they did, indicating that yes, employers can cover and require employees to be vaccinated before coming in, as long as certain conditions were met. And we'll talk about what those conditions are, but it's the usual ones that you think of, making sure folks have a reasonable accommodation in certain situations. So if you're requiring employees to vaccinate, and I will say a lot of our clients that we're seeing, it's not necessarily a mandate, it's more of a voluntary program right now with incentives. So I haven't seen outside of government workers, outside of healthcare workers, really haven't seen employers. I think I might have one client that has required vaccines in order to come into the office. I've seen more of a hybrid voluntary program. So as I said, the federal laws don't prohibit an employer from doing so, but there are some laws that come into play. So think about your employees with a disability or a pregnancy or sincerely held religious belief. You may, as an employer, be obligated to offer them some type of accommodation. That's an analysis that has to be done per employee situation. So this is starting to get very complicated for employers, and we recognize that. This is just best practice. I mean, I think at the end of the day, working with your counsel, your employment counsel, to say, what do we do if someone comes to us with disability? That one's a little easy. You can just ask for documentation from a physician. Pregnancy, pretty obvious. Again, physician, OBGYN. Religious beliefs a little grayer. And so I think that's where you may want to reach out to counsel to say, how protected are we if we just say no? Or if we start to accept religious exemptions, what happens if we open the floodgates and there are just too many people requesting that? What do we do in that situation? So there are a lot of unknowns, but I do think that those individuals might have their right to have an accommodation based on the laws today. So this is just a list of reasonable accommodations. These are not the only ones. You can certainly come up with others. This is just a suggestion. Most of our clients, what we've seen is the periodic test for COVID-19 if they're also requiring the vaccine. So I've seen periodic tests for the disease, or for the virus, I should say, once a week. I've seen telework. So a bunch of different reasons. Again, think through accommodations for that group of individuals per person. So it can be individual, per individual, to think about what works for them. So again, looking at the laws that impact these kinds of vaccination programs, at the end of the day, employers can do it, but but you've got to think about those other people that might put their foot down and say, no, I can't because of disability or other reasons. So this is what we're seeing more in our market, New York, New Jersey. Most of our clients are doing more of a voluntary program. And so these are the three different kind of categories of voluntary programs. The first is when the employer's the one bringing the employees, bringing the vendor on site, or maybe it's a provider's office that can provide the vaccine, you know, right out. In those situations, there's potential for ADA or GINA because there are questions being asked by the person who's giving you the shot. And those questions, if you, the employer, are the one paying this vendor to come on site, the EEOC doesn't love that. So you might be required to keep the incentive to just the amount where it wouldn't be coercive. And of course, there's no definition. We don't know what substantial means. And so what we see most of our clients do is that last one, and that is incentives in exchange for the employee going to somewhere else, CVS, mega site, whatever it is, to get their vaccine. They bring you their card. Now you as the employer have not seen any exciting ADA data. You didn't hear what the employee answered in terms of a conversation with the nurse who pricked their arm. At that point, you can give them as high of an incentive as you want. You can say $1 million if you get your vaccine. And if so, let me know if you're hiring because I would like to work there. So that is definitely something to think about, that you can increase the level of incentive if you're doing an off-site third party, no relationship with that third party. And again, that's what we're seeing more in our region. Confidentiality, this is a no-brainer. I mean, I think that during the last year, there were some conversations around whether the vaccine was HIPAA protected or that information is HIPAA protected. It's not, unless you're going to the group health plan to pull claims and see who is actually vaccinated. That's not really allowed, and I would not recommend that. But from a confidentiality perspective, the EEOC did say that those cards or data or information about the vaccination status should be kept confidential. So that means employers should really think about keeping this information separate from the personnel file. So separate, whether that's on a folder, whether you're engaging a vendor. We've worked with vendors that are able to do this on their platform rather than the employers. And it's pretty inexpensive, like $1.50 PEPM to do that. So per employee per month. So if you have a question about that or looking for a vendor, certainly reach out to Stephanie. We have some great contacts that are in this space and are just jumping into the space right now. So again, as I said, yes, you can absolutely mandate or incentivize the vaccine. We have an entire just white paper on considerations, which again can be an entire presentation. But at the end of the day, I think you really just need to think about, do you have to offer PTO for the person to go get vaccinated? In the state of New York, you do. In New Jersey, you probably have to let them take sick leave to go do that. If you're requiring them to get tested, do you have to pay them? Probably. And so these are the questions that you've got to think through. If I'm requiring my employee to step into a CVS, get tested, or get a vaccine, you're probably obligated to cover that cost. So that's really something to think about. What we're recommending in our region is clients really need to work with their own employment counsel. So while all this information is helpful, it's kind of sets the stage to tell you what you need to think about. Having a policy that is ironclad and has situations where you know as an HR professional what you're supposed to do if someone comes and says, I'm part of the church of Moderna deniers, which is like a real thing I saw the other day. And so that could be a religious exemption that someone has. So working with counsel to understand and training managers on how to respond to those kinds of inquiries, that's probably going to be your best bet. You want to have the same message to all employees that this is a political situation, which it shouldn't be, but it is. And your employees, you don't want to affect employee morale by instituting a policy that doesn't solve for those folks that are anti-vaccination or might be unable to get the vaccination because of those sincerely held beliefs or a disability or pregnancy reason. So we shared this slide internally, and I thought it'd be helpful for everyone. So on the left-hand side was just what we thought employers should be communicating to employees about COVID testing and vaccines. And on the right is what we suggested to our team to have conversations with their clients, employers. So really at the end of the day, looking at that public health emergency, how much longer do you have to pay for these things? Communicate, and it's okay to push things off. If you have a conversation with employees today, this is the policy. 6 weeks later, the policy has to change. That's okay. We're all working through this as quickly as possible. But again, work with counsel if you're looking to change any policies. We're finding a whole bunch of loopholes in the guidance, and that's part of my job, is to have 22 other attorneys on my team. And all we do is poke holes in these policies because we want to make sure that our clients are protected. So this is just kind of a strategy to think about some of the changes and just on the ongoing complexity of vaccines and testing. Okay, the vaccine and group health plan and premium surcharges. So this was a super hot topic a few weeks ago. I think Delta Airlines was one of the first ones that came out and said, we're going to charge everyone $200 more if you're not vaccinated. And I'm pretty sure the entire office of USI freaked out, flipped their desks, and was freaking out about it. And they all reached out to me. How is this possible? It is possible. And we'll talk about how that's possible and why it's really not suggested for most clients. For Delta Airlines, I think it made sense. They are, from a PR perspective, they need to get folks vaccinated. It's going to get folks to get back on the plane. They're Delta Airlines, not a great time to be a Delta airline right now. The name Delta is not great. And so I think that was part of a PR situation. That said, the premium surcharges are legal, but you have to do them through a wellness program. And we'll talk about why that is on the next couple of slides. The one thing I did want to say is that Delta shared about 2 weeks ago that they were able to get thousands of employees vaccinated after they announced this surcharge. So that's a great ROI, but I'm not sure that it's gonna work for every client. And we'll talk about why that is in the next couple of slides. So there are 3 laws that impact group health plans as it relates to wellness programs. I am not going to kind of do a deep dive on all of these. The first one is probably the biggest. The other 2 are quick. We'll do that one quickly, but there, again, you can absolutely get more guidance on that from your counsel. So we'll talk about HIPAA. All wellness programs, no matter what you're doing, are either participatory or health contingent. Participatory is super easy. Those are the ones where you've got a walking challenge. The employee doesn't have to prove something that's health related in order to get that incentive. And those are kind of low bar wellness programs. The ones where now you're requiring participants to go do something medical or share something with you in terms of a health factor, that is where there's a limit on incentives. And that $200 per month for Delta Airlines met this incentive limit, because again, that program requires someone, health factor, vaccination, in order to hit that eligibility. They're having to go to the doctor. They're going to have to go get vaccinated. And that is considered health contingent. Right now, we do not have any guidance from the departments in terms of whether, the COVID-19 vaccine, tied to the group health plan. If you can do that, we're assuming that you can through the wellness program guidelines based on what we know today. Tomorrow, this could change. The EEOC could come out and say, we're looking the other way in terms of incentive limits. We want everyone to be vaccinated. So again, more to come on that. But I think right now, conservatively, if you're tying your incentives to the group health plan, you want to make sure that you are meeting the health contingent wellness program requirements. So the health contingent wellness requirements, which is most of the clients that we have with wellness programs, they're more robust. The regulations, or I should say the departments, of course, they don't want employers to be forcing employees to give over data. So they really want to make sure that the employer is doing the right thing from a wellness perspective. There are 2 philosophies on whether, there are 2 different kinds of programs. There's an activity only or outcomes based. Activity only is where you're requiring the employee to go do something and then they'll get a reward. So maybe they have to go to their physician. That's a reward. Or they have to get a flu shot. That's a reward. The outcomes based is more where they've got to have a particular health status. So they've got to prove that they're a non-smoker, or they have to prove that they hit the right cholesterol, the BMI. That's an outcomes based program. The question is a COVID-19 vaccine program activity only or outcomes based? You could make the argument either way. And the reason it matters is because of a reasonable alternative. And we'll talk about that in a few slides. Conservatively, USI is going to assume that the programs are outcomes based because it is more conservative. If you do not agree, talk to your counsel, and that might be in your best interest. And we'll talk about why on the next slide. So these are the 5 things that all wellness programs have to offer. The HIPAA requirements require those 5 things. Employees can do it every year, that the total amount doesn't exceed 30% of the premium, that it's reasonably designed, that the full award is available to people who get reasonable alternatives. So we'll talk about that. and then that you disclose the information. Pretty easy, but it's that fourth box that I want to direct your attention to. So if you have an activity-based program, the reasonable alternative standard has to be offered to anyone where it's unreasonably difficult because they have a medical condition in order to meet that standard. Here, the employer is able to ask for physician verification. So you can say, okay, you can't get the vaccine because you have a disease. You've got to let us know via documentation that that's the case, that you are allowed to, from a physician, not get the vaccine. It could be reasonable in that instance to treat the reward with the vaccine program as an activity program. So that could be one way to think about it. On the right-hand side is the outcomes-based. In an outcome-based program, any individual who can't meet that first standard, which is going to get vaccinated, then the plans in that instance can't ask for a physician certification or verification. So in that instance, if you go with the conservative approach, you might end up having people that are asking for an accommodation. You can't prove that through asking the physician verification. Now someone asks for an accommodation. Do you have to give it to them plus the reward? Yeah, you do. So now you've got to give them the accommodation of possibly weekly testing, plus the incentive that you're giving everyone else to be vaccinated. So really, is it moving the needle? And I think that's the question. And I would love to see the data from Delta Airlines to see how many people, are in that instance where they are asking for reasonable alternatives and receiving the incentive plus receiving COVID-19 testing for free by their employer. That's a lot of money. That's a lot of money to not move the needle in terms of incentives or in terms of people actually getting vaccinated. I'll share that what some of our clients have been doing is instead of tying it to a premium differential, they're adding it as a way to get more points. So similar to a program where you've got 5 things that you can do in order to achieve the wellness rate, one of the 5 might be a vaccine, but you don't have to get the vaccine if you do the other 4. So that's another thing to think about. Again, not going to move the needle in terms of getting people vaccinated maybe, but it's at least not putting you in a situation where you have to think about alternatives. So just something to think about as well. Again, talk to your counsel. Is our program activities based, or we can ask for doctor verification, or are we outcomes based, conservative, and now we can't ask for proof? What do we do? These are the slides I'm not going to read through. At the end of the day, the ADA, pretty much, again, you don't want to ask disability questions by your employees. So read through this. It kind of talks through some of the voluntariness of the program, which the EEOC wants the program to be as voluntary as possible. They don't want you to be seen as coercing. That's why that 30% is there. If you gave employees, I'll give you free medical coverage if you get vaccinated, that's going to seem coercive in the eyes of the ADA. So here the recommendation would be to request vaccination status from a third party rather than having it on site or internal if you're going to go that way. GINA is usually what comes up when you are asking for questions or asking information or discriminating against genetic information. So if you're asking spouses that are on your plan, for example, to be vaccinated, again, we would recommend that proof of vaccination from a third party. The last thing you want is to invite third party into your space and now be limited by the information you can ask or be limited by the incentive you can provide. Okay, so as a recap, this is a really good summary of the things that we just discussed with regard to vaccinations and incentives. So again, third party, that is kind of the gold standard, keeps you out of trouble and keeps you out of some of these regulations. Thinking about accommodations for those that have a disability, thinking about accommodations for those who have a religious belief. The percentage that you're providing, is it permissible, that 30% number? It's on that total premium. It's not just on the employee rate, it's on the total premium. If you're asking family members to be vaccinated, do you do so by an unrelated third party? You probably can't ask dependents to get vaccinated. So there are a lot of requirements here. And all you're trying to do is offer an incentive program. And it blows our minds sometimes just how complicated these programs can get when all HR is trying to do is, again, move the needle, get more people vaccinated, more people in the office, and hopefully going back to normal. That would be great. And so employees that are vaccinated by the employer or the agent, that's where you're going to have some limitations. And so you can certainly do that, but we would caution that if you are giving a large incentive. Other considerations, so we talked about providing the reward, so you'll want to look at reasonable accommodations. There might even be state law accommodations that are needed. Affordability, when you're looking at the rate of the employee only low cost minimum essential coverage plan, you got to make sure that plan is affordable based on the unvaccinated or non-compliant participants. So you can't base affordability on what your vaccinated population is doing, but you've got to do it on the unvaccinated. So that could impact you too. Grandfathered status, not many of our clients really are grandfathered, so read that if that applies to you. Implementing this with renewal, tough because, you know, if you've got a 1-1, it is difficult to implement these programs. That's of course best practice, but I don't know too many employers that have their dots, T's crossed, I's dotted, like no one is ready for this, but this is at least what we are suggesting from a best practice. It always makes sense to do it on renewal, or at least communicate to your employees that this is the intention. Confidentiality, keep those documents separate from employer employment records. HIPAA privacy rules, again, you don't want to identify unvaccinated employees based on like looking at the group health plan. Collective bargaining agreements, state law. What about if the federal or state mandates require that employers have to vaccinate their employees? Is there going to be an incentive or surcharge even needed in that case? For example, with the Biden administration announcement that he's asking the DOL to create regulations and guidance for large employers over 100 that will have to require their employees to be vaccinated or get tested. Again, we don't have any regulations today. That's just an executive order, kind of his plan. So more to come on that. But that's another reason why I think a lot of our clients are waiting before they implement something like this, because if you're already mandating it, there's not really a reason to do it on your group health plan. Can we exclude unvaccinated from our group health plan? Probably not. HIPAA requires that you don't exclude anyone from the plan based on a health factor. And the health factors are on the right-hand side. I do think that vaccination status would be considered a health factor. So you can't just say, no, if you're unvaccinated, you don't get coverage. That is probably not allowed. Can you exclude hospital claims for unvaccinated participants? Probably not, unless you're willing to not cover any COVID-related claims for anyone, which really is probably not best practice or suggested, because now we know vaccinated individuals can get COVID-19. So now you are taking away a benefit from people who did the right thing in terms of getting vaccinated. So not sure if that really is the right call, but again, think through the culture of your organization if you really want to exclude all COVID claims outside of what you're obligated to cover. Okay. So some takeaways just in this section. Looking at premium incentives to encourage COVID vaccines. If that's the way you want to go, using premium incentives, figuring out what kind of program you have, whether it's activity only or it's outcomes based, that's going to determine what kinds of alternatives you have to provide. Having folks go elsewhere, looking at group health plan eligibility and affordability. It's not advisable. Don't exclude the unvaccinated, and definitely don't exclude hospitalization or treatment just for unvaccinated. As much as you might want to, HIPAA would not like that, and neither would your employees. Okay, surprise medical bills. So this is very interesting because, again, if I had done this presentation 6 weeks ago, this would have been totally different. So there were some guidelines that came out that affect our group health plans that came out back in 2020 on the right-hand side. Those are the transparency and coverage rules. And then on the left-hand side is the Consolidated Appropriations Act. I've put them here side by side because when we talk about some of these rules and some of this guidance, it's found in both places. So I don't think it really matters where it came from, just you've got to do it. So this is helpful just to kind of the framework for what we're about to talk about for the items that are coming down the pike. So this no surprise billing, this is actually not super exciting for the state of New Jersey. So for those of you that have fully insured plans, there was already some type of surprise medical billing in your plans outside of air ambulance. I think that's something that wasn't in our fully insured market. So the No Surprise Act functions pretty similarly to what we see in New Jersey, where if someone is going for an emergency and they don't have the choice of choosing an anesthesiologist that's in network at that time, the employee would only be subject to the in-network fee, even though that emergency service anesthesiologist is out of network. And there's a whole framework. There's a almost like a mediation arbitration process in order to get the provider the funds he or she needs, but also mitigating the No Surprise Act. So there are a whole bunch of rules under this. We'll talk a little bit about that on the next slide. Your fully insured plans are going to be subject. Your insurance carriers are responsible for compliance. So they're going to handle any requests for out-of-network arbitration, any types of requests from providers. Still think it's important to know that your employees might start to see some information on this. For self-insured plans, the plan sponsor is responsible for that kind of compliance. So conversations with your TPAs or third-party administrators is paramount right now. You've got to find out, are they assisting with the No Surprise Medical Bill Act? If yes, what's the cost and how does that work? Because you as the employer don't want to receive your first notice, because as I said here, if the claim is denied, then the employee or the provider is sending a notice to the group health plan to say, hey, I want additional funds here. I'm trying to balance bill. And so you want to avoid those situations. So having a conversation with your self-funded TPA is the best call to find out how are we in compliance with the No Surprise Act. So here's what to communicate. Again, here's that slide I shared internally with our team. On the left-hand side, this is what you can communicate to employees. I don't think it's as necessary in the state of New Jersey because, again, I do think fully insured plans were already kind of doing something like this, but it's always good to communicate with employees to let them know what rights they might have. And then on the right-hand side was my suggestion to our team members on how to have conversations with employers. So I would hope that whoever your current broker is has had this conversation with you on the right-hand side. If they have not, call Stephanie and she'll have the conversation with you. So transparency and coverage and the CAA. So some of these deadlines were delayed. So here we go. These are one slide after another in terms of what's been delayed. And I think it was welcome because the carriers and PBMs, the pharmacy benefit managers, all of these third-party administrators were running around like chickens without heads when the regulations came out, because it happened right at the end of the pandemic or right at the end of the year, 2020. And so I wish it was the end of the pandemic, but it's not. So at the end of last year, all of these deadlines were, coming, and then they delayed it a couple of weeks ago. So that really changed a lot of our guidelines. We were all trying to figure out, okay, we've got to get our clients this information, that information, and then they delayed it. So definitely welcome the delay, just adds more complication. Okay, so transparency and coverage as it relates to machine readable files. Right now, we're pushing that off to July 1, 2022. Doesn't really affect you as an HR person, but your group health plans have to have some type of machine readable files, the requirement on the left-hand side. The right-hand side is this relief. So again, pushed off. Let's not think about it. Again, go back to the slide if you're not sure what this means. Price comparison tools. So this was an expectation that group health plans and carriers provide some type of disclosure on cost sharing for certain benefits. So that has been pushed off till next plan year. So now again, not now, push it off. Good faith estimate and advanced EOBs. There was an expectation that individuals for certain benefits or certain services would receive an advanced explanation of benefits. So in advance of going to do XYZ, they would receive an EOB that says, this is what you'll be expected to do. Originally, effective date was 1/1. They've pushed it off pending future guidance. So they need more regulations is basically what they've said in order to do this. So I do think that, again, we're going to see increase in costs because all of these requirements, someone has to do them. So they've got to hire analysts. They've got to hire folks to make sure that these programs are implemented in your programs. Reporting on pharmacy benefits and drug costs. So again, this was a requirement that 50 most common drugs and 50 most costly have to be sent to the government on an annual basis. And that effective date was at the end of next year. It's been pushed off until the end of the following year. So again, we need more rulemaking. It's the industry basically pushed back on the guidelines and said, there's not enough information here for us to do what you want us to do. And so they're asking for more rulemaking. Insurance ID cards. This is in effect. So for those of you that your contracts with your carriers, you want to find out whether they are going to spit out new insurance ID cards. I heard from some of the carriers, for example, UHC was only going to do this if it was time for your plan to get new insurance cards because they were posting them online. So if they're posting them online, let your employees know that's how you can obtain a new insurance ID card. There are no regulations that are going to be implemented or provided until after the new year. So there's a little bit of this good faith relief. So I see the carriers not really caring about the insurance ID cards, but take a look at that. If it's your turn to get new ID cards, make sure it's meeting this good faith relief so you don't have to reprint them next year if the regulations end up staying the same. So there's some gag prohibition on gag clauses and quality data, again, pushing this off to 2022. Originally, it was going to be effective at the end of 2020, and they're like, we don't have time for this. And so again, they pushed it off again. So we're going to find out more information about that in 2022. Provider directories, group health plans were supposed to verify and make sure that there were all these providers listed that were in network for this plan year. We are doing good faith. So again, they're expecting group health plans to do this, rely on your carriers, rely on your TPAs to be able to meet this good faith requirement. So I think that good faith would be posting it on a legitimate website, maybe not every 90 days, maybe every 120 days, and then getting that number back down to 90. The regulations really just want employees or participants to have more transparency. And so all these regulations is really about transparency in healthcare. As we know, there's very little transparency. So this is a very nonpartisan requirement. I mean, these regulations went in under Trump. Biden has not really done much except push them off because the industry has asked for that additional time. Balance billing, pretty similar to what we see in balance billing requirements on the state, but this is a federal requirement. There will be certain balance billing protections that, again, good faith relief starting January 1st. So it's required, but good faith is expected. Work with your TPAs, your carriers, to make sure that balance billing has been disclosed properly. Continuity of care. So this is the last one that's been delayed, or at least has been provided good faith relief. So again, this is a requirement on the left-hand side that an in-network provider that becomes out of network has to be notified and given the opportunity to receive that coverage. So again, the patient who's in their treatment, you want to make sure that they keep that in-network status if for some reason the out-of-network, or if for some reason the network kicks the provider out. Again, good faith relief starting January 1. Broker transparency was not delayed. And I think it's important. I wanted to point this out. USI is currently working through some of our agreements to ensure we're meeting all these requirements. We pretty much were before, in terms of disclosing to all of our clients. But this is something that a lot of other brokers aren't talking about. And I think you know why. But it is really important to always know what you're paying your brokers and that you're understanding that the value that they're providing is sufficient for what you need. You don't have to go with the cheapest amount. You don't have to go with the cheapest broker, but you got to go with one that is reasonable, that you are meeting your fiduciary standard by going out to the market, seeing what other brokers are charging, so that you know that the service you're providing is what you need and that you're comfortable from an ERISA fiduciary perspective. So you'll start to see at the end of this year, new agreements, new notices. I would suggest paying particular attention to it. There are a lot of brokers out there that are making money hand over fist with not so much accurate agreements. So again, take a look at that. Transparency is huge as it relates to brokers and really any consultants that work on your group health plan. It's very similar to the 401k side. Now we're bringing it over to health and welfare. So here's what to communicate on the left-hand side. Again, notify employees if you want to be more proactive. On the right-hand side are what we communicated to employers. Again, take a look at that. In the interest of time, I'm just going to keep trucking away. So here are the takeaways. I think at the end of the day, really talking to your broker, talking to your TPA, talking to your carriers. How are we handling the deadlines that are either delayed or the good faith? How are you going to meet them? Whether it's January 1 or July 1, whatever it is, how are we meeting it? And what is the cost associated with that? All right, mental health parity. So mental health parity is a very interesting requirement that this happened pre-pandemic, has nothing really to do with the pandemic, but I do think that it has caused a little wrinkle in our renewal process as we're trying to have conversations with our clients. And here's why. So the mental health parity laws, what they basically say is that if you offer a mental health or behavioral health or substance abuse disorder benefit, any limitations you provide on that benefit have to also be provided on the surgical side. So what they don't want is people having to go over a bunch of hoops on the mental health substance order side that they don't have to on the surgical side. So they want the mental health benefits and the surgical benefits to be on par. It's pretty easy when you're talking about financial limitations in dollars in terms of comparing, but we're going to talk about other things that you can't really compare dollar for dollar. So these are employers that are at least 51 employees, offering a group health plan if you offer mental health or substance abuse disorder benefits, which most people do. Insured plans in the small market are required to provide essential health benefits. And then those essential health benefits have mental health, benefits. So again, mental health parity in New Jersey, New York, it's been a conversation on the fully insured market for a long time. But I think right now, this is basically the federal government, the DOL saying, yeah, now we want to make sure that all these plans are on par from a mental health perspective. So there are two types. The one on the bottom is the easiest one to have a conversation about because it's a dollar, it's a number. So whether there's a limit on frequency of treatment or days in a waiting period, those numbers can be compared number for number. Those are easy. Non-qualitative, or what they're called non-quantitative treatment limitation, or NQTLs, that's where there's not really a number. So it's that soft stuff, things like prior authorization, a step therapy, things that aren't really numbers. So it's very subjective. And why is this important? It's important because the DOL has basically now said that employers or group health plans, whether it's carriers or it's the self-funded plan, has to provide an analysis of their plan that says, we don't do that. We don't, all of our plans are on par, and this is how. And it's robust. It's a very robust analysis. It's subjective. It's information that I don't think any employer has on file. It's something that carriers, TPAs, have the power and the information to do it. Right now, USI has had kind of a tug of war with the TPAs and PBMs. They're not really playing ball with mental health parity. And there's a reason for that, I think, is that it's really expensive. It's very robust. We're talking 40, 50 pages of a chart of, what is offered and why we think this meets the requirement. The TPAs that we've seen have kind of said, well, we're not responsible for that. Self-funded employers are. We disagree and we're pushing them. As an aside, there is a client that we are aware of that had received one of these, and they had 5 days to turn over the analysis to the DOL. It's very quick. And in that case, the TPA helped. So it almost seems like the TPAs are willing to, if audited, which isn't a great standard because it's not just the auditors that can ask for this. An employee participant can also ask for this. So that's my concern as a compliance attorney. I don't have a solution. I wish I did. There are vendors out there that are just now getting into this space, but you're still asking for data from the TPA or from the carrier. So why can't you just do it? Just charge us for it. So again, I'm not really sure what that is going to do in terms of, maybe next year we'll start to see more vendors pop up. But I think it's important to have a conversation with your TPA or ASO to say, hey, how are we doing on mental health parity? Do you have any tools? Do you have any resources that we can get ahead of time so that if the DOL comes to us, we can at least provide them something? A lot of the big carriers were providing kind of like a sample tool to say, this is the traditional 90% of the benefits that we offer to all of our clients. This meets that standard. But if you're going outside of our traditional plan design, that's on you, which is understandable. But I still think, again, the TPA and ASOs are the ones doing the work. So they should be able to take a look at the soft, requirements for employees because they're the ones setting them. So again, more to come on that. I really think this is a space where, especially for autism spectrum treatments, I think a denial there could trigger a request for a participant to say, hey, let me see your analysis. I want to see what that looks like. All you need is a savvy attorney in this space to ask for that. And right now, the DOL it's really only audited a very small number of employers, and I'm only personally aware of one organization. So, is this a risk you want to take? Some companies are fine with it, and they're just going to wait and see. So just wanted to point out that this is an area where, again, your broker should be talking about this with you and what they're doing to support you and advocate for you against the TPA and ASOs. So there is a self-compliance tool that the DOL provides, and there's a link here. The link is live, so you can certainly click on it when you get the slides. If you are watching the recording and you want a copy of the slides, reach out to Stephanie and her information will be our last slide. But again, there is a self-compliance tool. You can certainly look at it. It's helpful so that you understand what the DOL is looking for, even though they don't really know what they're looking for. This self-compliance tool will kind of show you how robust this analysis really is and why the TPAs are better served. If you're fully insured, your carrier should be doing this for you without issue, but it's good to ask, to say, hey, where is ours? Can we see a copy of it? That way you have it on hand should you ever get requested. Miscellaneous. So this is just kind of a hodgepodge of things that are still in effect. So there were some relief that was offered for health FSAs and dependent care FSA programs. That was during the pandemic. The IRS was trying to help employees utilize the funds in their FSA when doctors' offices were no longer doing, elective surgeries or things like that. So there is an additional plan sponsor discretion. So you're not required, this is your discretion. As an employer, you can allow employees to carry over an unrestricted amount into the 2022 plan year. So you're not limited to that $550. You can allow employees to elect the full amount. Some of our clients have chosen not to do that. They felt like when it was time to elect that 2021 benefits, the pandemic was already here. So they felt like employees should have known that they should not have elected the full amount. That said, it's no skin off your back to allow them to carry it over. It does mean that those funds would not be forfeited back to you as the employer, but would be provided to the employee. From an employee morale perspective, it's their dollars, so you might as well let them use it, but it is administratively could be burdensome. So work with your vendors to make sure that they are implementing that or not in your plan documents. The health FSA, again, the spend down, so that's going to be expiring and not available in 2022. The 12-month grace period for the, if you have a grace period, that's going to, again, extend into 2022. Dependent care programs, there's really not going to be that relief for the overage. It was for those folks that turned 14 during the pandemic and employees were kind of out of luck on the funds because the child was no longer eligible. And then prospective health FSA changes. This would have allowed employees to change their election in the middle of the plan year. You would have already made that change at this point. I don't think any of our clients are looking to allow employees to revoke their elections at the end of the year now, but that was available last year as well. If you've made any of these changes, please work with your FSA vendor to update your plan documents just to make sure that that information is the most accurate, because this really is outside of the natural, normal plan rules. Qualified expenses. So this is actually, again, not really COVID related, but I think it's important for HR to know, especially when you're thinking about allowing an extension for that FSA. Employees can actually use their FSA, HSAs, HRAs, any type of eligible tax favored account that covers medical expenses listed in the IRS code. If that's the case, you can also cover masks, hand sanitizer, sanitizing wipes, so PPE. There's also at-home COVID tests. So there's a link here to the IRS guidelines there. If folks want to get their COVID home test, they can use their FSAs, health FSA or HRA. You can also utilize it for menstrual products. So tampons, pads, cups, anything as it relates to menstrual products. And then over-the-counter drugs. That was last year, but I think it's helpful, especially again, as folks are trying to spend down that FSA, just go to Walgreens and you can actually use it at the point of sale, your card. You would not have to substantiate a pharmacy claim at a pharmacy. So that's really helpful, I think, for employees to know, especially if they've only got a few dollars. My suggestion to our clients was run a report on close to the end of the year to see how many of your folks still have money left over. And if it's substantial, maybe think about extending that carryover. If it's like $300, then it's not worth it to allow everyone to carry over all of it because no one is going to carry over more than $550. And then you wouldn't have to update your plan. So just something to think about to see whether it's even necessary for your population. So you don't do more work than you have to. And then I think this is my second to last slide. So ACA always requires for certain benefits to be covered if they're preventive. So there's a whole task force in the government of physicians, providers that decide what is going to be covered as a preventive service. So they're the ones that might say, okay, at the age of 30, you no longer have to come for a pap smear, every year, maybe it's every 2 years, whatever. They're the ones who set that standard. And so right now, the preventive care services that are offered in ACA plans have to be covered at no cost. So there are some items on the left-hand side that are being added for 2022. So if you have a non-grandfathered plan, self-funded, fully insured, does not matter, you would have to cover this preventive care for 2022. Your fully insured carriers are already aware of this. Your self-funded carriers should be as well. But you'll see on the right-hand side, if you've got a 1/1 plan year, some of these don't apply to you until the next open enrollment. So just take a look at that as well. So these items that were listed here either became effective maybe last year or this year and will be effective for any plan years that begin on or after. So for 1/1. So New Jersey, this is an interesting question. So I was having this conversation with our consultant, our USI consultant. I think she's on the call too. Hi, Jill. We were talking about how New Jersey's been really quiet this year. And I really think the reason they've been really quiet from an employee benefits perspective is that Governor Murphy is running for re-election. I believe that is a reason why we haven't seen as much in 2021. 2022, Governor Murphy, Governor Cuomo were kind of, if Governor Cuomo did it, then Governor Murphy did it. So we were kind of working hand in hand. The state of New Jersey kind of expanded some of their disability and paid family leave to cover some COVID claims. Really wasn't that exciting because really that was kind of already in the regulations. They just specifically wrote out COVID. New York did kind of an overhaul of their sick leave. New Jersey already had it. And the last 6 months, New Jersey has been completely silent on COVID, even as it relates to some guidance for schools. So it's very much, kind of hedging his bets. And I do think we are likely going to see more after the election, whether he wins or he doesn't. I would imagine we might see some more state mandates that are a little more aggressive, like we're seeing in New York. In New York, going into in the city, going into a restaurant, you've got to show your vaccine card. Will we have to do that in Jersey? I don't know. We'll have to see. So not too much to update you from a New Jersey perspective, but I do think more to come. I would definitely keep an eye out in November to see what happens if he wins or if someone else is elected. So these are just some takeaways. We have like 4 minutes left. So just some takeaways, kind of working your way, through these. You could go through this entire presentation and have different takeaways. I think at the end of the day, it's to look at these slides when you have time, not with your lunch, and take a look at whether your broker has had these conversations with you, whether you're even aware of it. That to me is the biggest piece. You might not have to understand all of it, but if you're aware of it, then I'm happy because now you can come ask us questions about those items. And again, we can absolutely talk about every single one of these slides for hours and hours. And we have, Stephanie and I talk about these things all the time. That is, our role as USI consultants. And so on the next slide, I'm just going to share our contact information. You can also add me on LinkedIn. I'm always willing and looking forward to connecting with folks on LinkedIn. So feel free to reach out to me. If you have any questions, whether it's on content, whether it's on getting a compliance update, reach out to Stephanie. She is going to be your go-to in terms of finding the right resources. As she mentioned earlier, USI has a whole host of other resources that's not just compliance. There are 22 of me, but there's also population health management, analytics. And so we can go into any of these kinds of issues with a deeper dive with the right people. So definitely have a conversation with us. On the next slide, I am going to share the SHRM activity code, and I will chat it as well. But for those of you that are watching the recording, I can't show you the SHRM code, but if you need certificate of continuing education to prove to your company that you watched this, certainly, again, reach out to Stephanie and we can get you that certificate.
Well,
SHRM,
I'd be more than happy to answer any questions and send them over to Yesenia if I'm not so sure about the answers, as I am not a compliance attorney. I am a consultant. So again, just wanting to thank you so much again. And please reach out to me if you have any other questions or concerns. Thank you. And thank you to the Morris County Chamber for partnering with us on this event. And we hope to do another one soon.
All right. Thank you so much, everyone. That was jam-packed full of information. Thank you so much. I learned a couple of things like that FSA comment. I love that. So again, thank you so much for joining us today. We hope to see you on the next webinar or in-person event. So take care, everyone.
Thank you.
Hope to hear from everyone. Take care. Thank you, Yesenia.
No problem.